and I feel tons better. I'd recommend you to anybody. Like I said, I did bring my brother here. That's had, I think he's had 2 major strokes, 5 minors, to see if we can't change him.
Yeah, we're gonna.
And I honestly believe that you're the man that can do it.
Thank you.
Like I said, I've been to several different doctors that they could never find nothing wrong with me. I mean, and said, hey, you know, I even had my wife tell me it was in my head. And I said, all right, whatever. But I mean, she's seen a difference in me. Not like I have, because it's my body and I feel it. And when there's something wrong with you, you know it's wrong. Something's wrong with your body. And so I would definitely say, hey, it's a life changer to come here and have you do your testing, send me home, and within 90 days start feeling amazing.
Yeah, awesome. Thank you for sharing.
Thank you, sir. I appreciate you. I feel like you saved my life.
Thank you, man.
Thank you, sir.
You can get better. Real proof. Dramatic change from his bladder to his pain, to the pain in the head, to the respiratory, the sinus, blood pressure, and heart rate changes that are, it's second to none. When you find the infections and the chemicals that are in the body's tissues and get rid of them in a safe and very highly an effective manner that's so rapid, it's life-changing. Hello, if you have high blood pressure, if you have neuropathy, if you have a bladder control disorder, if your heart rate is up, if you have a respiratory condition, a chronic sinus condition, you deserve to listen to this man. This is Mr. Glenn Davis, who lives in Texas. He comes to my clinic here in South Florida, and the dramatic improvement from many symptoms he's experienced and reduction in medications is what you deserve to hear right now, because his reality now is much different than it was before November, when we met, November of 2019. Right now, I'm Dr. Lonnie Herman, and right now this is, what are we, July 7th of 2020. Excuse me. We are July 7th of 2020. And his change is remarkable. So he's here to help share with you the incredible improvements that he's made in just one round with my unique process. So, Mr. Davis, tell us, one of your conditions was high blood pressure.
Yes.
And when you first found out about the high blood pressure, how long ago was that? Around what time was that? What year? What
It
month?
was about 2.5 years ago.
Okay.
I'd never had high blood pressure. All of a sudden, I mean, it jumped off the scale. Most of the doctors said I should have been dead from it. It jumped up to 252 over 247.
252 over 247.
Yes.
And you still survived.
I still survived. No strokes, no heart attacks.
And they gave you a medication.
They gave me a medication.
And did that bring it down?
No.
The blood pressure stayed high with the medication.
Right. I was still taking, they started me on a lower dose. They took me up a higher dose. I think they started me at like 40 milligrams on one, 2 milligrams on another one. Went up to 85 and 5 milligrams.
85 milligrams and 5 milligrams of the other.
Yes.
Did the blood pressure come down with those meds at that high level?
Helped it some.
And now,
but it was still very up and down. I mean,
up and down.
I mean, it'd still get up in the 200s, and then we got it to where it was settling in the 170s, 180s. Mm-hmm. It was still jumping up in the on the bottom side. It was still staying in the mid 90s. Mm-hmm. Sometimes it'd jump up to 100, 110 side. Mm-hmm. I mean, but it was like a roller coaster.
A roller coaster. And now, after your first protocol with me, which was some diet changes, but we also helped to remove different infections and chemicals that were in your kidneys and the brain and the liver and certain tissues, which I'll get into in detail later in another part of this video. But after you followed that very simple to follow protocol at home, it was simple to follow, right?
Very easy to follow.
Very easy to follow. After you followed that protocol, or during following the protocol in the first about 2 weeks, what did you notice? Because you also had a very elevated heart rate as well.
Right.
Before we talk about the blood pressure changes, please excuse me, your heart rate was around what before you came to me?
I could get up out of bed in the morning, my heart rate was between 125 and 130 consistently, almost every day. I mean, I could raise out of bed, take my blood pressure, and then my heart rate was 125, 130 all the time. Consistently, it averaged around 115, but its high side was 130.
And with the blood pressure medications, did that bring the heart rate numbers down?
No, none.
Did the doctors, the cardiologists, did the hospitals ever tell you anything to bring the heart rate down?
No.
Nothing. In your first about 2 weeks or so, in your first protocol with me, what happened to your heart rate? What did you start to notice about the heart rate?
On the first protocol, within the first week, I noticed that it dropped it down to around 90, 92, pretty consistently.
And after you completed that first protocol, where is that heart rate at now?
Now my heart rate stays between an 82 and a 90
Okay, and that's...
in the morning times when I'm out of bed.
And now it's going to get even lower. We're going to have a follow-up with him when he gets done with his second protocol that we just figured out today from today's exam, July 7th of 2020 again. Along with your heart rate dropping dramatically down to an almost perfect level, because if it's at 60, I'm really happy. But it's a lot better at 90 than it was at
82 to
115,
92, yeah,
82,
it's a lot
92,
better.
It's a lot better. Your blood pressure, again, it was, how high was it with the 2 blood pressure meds before you came to me?
It was consistently 180, 190, over 92 to 100.
And where is it now?
Now I'm taking a quarter.
We talk about the meds.
I'm
Before we
taking a
talk about the
quarter.
meds. What does the blood pressure get to now before the meds? Before we talk about the decrease in the meds, what number is the blood pressure at these days? What's the average?
After my first
After
round,
the first round with me.
I'm only having to take blood pressure medicine about every 5 to 7, 10 days now.
So only, and how much of the blood pressure, those 2
A
blood pressure
quarter
pills?
of what I was taking.
A quarter of each of those pills?
Yes.
Decreased down to a quarter, and you're only taking that quarter amount on either the 5th day or 7th day or 10th day?
Right.
Right.
It all depends on how stressed out I am. But I mean, most of it, I can go 5 to 7 days and not have to take blood pressure medicine. If I take it, it's still only at like max. I've seen my blood pressure now is one. Normally it's around 135, but I have seen it go up to 152, over 82.
What is the lowest that you've seen your blood pressure without the medication now since you completed your first protocol with me?
I've seen it below normal at like 117 over 77
That's
many
amazing.
times
And that's without taking the blood pressure?
without taking blood pressure
Just
medicine.
getting up and functioning normally?
And functioning normal every day.
Excellent. I love it. And
I do too.
Another problem that you had was you had this head pain that was on the left side of your crown up here.
Yep.
So how long did you have that head pain?
Ever since my blood pressure shot up the very first time. I mean, because
So-
whenever it got up so high, it felt like my head was going to blow off my shoulders.
And on that left side of your head, you had that discomfort or that pain that was going on for at least 2 years. before you got it.
As long as I've been on blood pressure medicine.
And you went to neurologist or did you
I went
go
to a
hospitals?
neurologist. I've been to a couple hospitals, heart doctors,
What kind of tests did they run to find out why your head was hurting? Besides blood pressure,
CT scans.
did they find anything wrong that they could label as why your head was hurting?
Nothing.
Was your blood pressure normal at some times when you went in because of the blood pressure meds? Was it normal, but you still felt the head pain?
Yes.
Yes. And how much now, after your first protocol with me, cleaning up different infections and chemicals out of certain organs and out of his brain with my work, how much of a decrease, how much better does that left side of your head feel?
Oh, I'm going to say 90%. I very seldom feel the pain on the left side of my head unless my blood pressure gets up to around 150.
Okay, and once you take the medicine to bring the blood pressure down from 150, does that decrease the pain on the left side of the head?
Yes.
And when that pain happens on the left side of the head, does it get back up to the level that it was when before we first
No,
met?
not even close.
Not
I
even close.
don't think I've seen my blood pressure above 152, over 88 at all
Amazing.
since I've been on your protocol.
So your head, on the left side of your head, you've got 90% reduction in the symptom, and it's barely ever happening. That you
Right.
notice it happen.
Right.
You had a urination problem, a frequent urination problem. So,
Ever since
and
I-
it was an urgent and frequent.
Yes.
Overactive bladder.
Very.
Was your bladder painful at all? Did you have any cramping, pain, pressure in the bladder?
I didn't have cramping or pressures. It's just whenever the urge hit to go pee, you better be moving to a toilet or outside of a swinging door fast.
Okay.
I mean, because if not, you're going to pee all over yourself.
Got you. So we're not going to call this, it's not a painful bladder disorder. It's not because there's an interstitial cystitis condition where there's painful, but yours was overactive. It was acting up all the time. So there's an overactive bladder. That's probably the diagnosis I would give it if I was diagnosing it. But you were going how often in the nighttime? When you were trying to sleep, how often did you wake up to go pee?
Every hour.
Every hour.
Every hour.
And how often did you have to go pee in the daytime?
Probably pretty close to every hour.
Pretty close every hour. So you went on average, you'd say 20 to 24 times in a 24-hour period.
I'd say at least probably 18 to 20 times.
18, 20 times. And so with 18, 20 times in a 24-hour period, how many months or years did you live with that bladder problem for?
It started shortly after I got a CT scan and my blood pressure medicines. I never had a problem with any of the stuff until...
So the CT scan and the blood pressure med, then all of a sudden the bladder problem started.
Yes.
Or were you taking the same blood pressure medicines that caused, that you think triggered the bladder problem? Were you taking the same blood pressure medicines when you first met me?
I was taking the same blood pressure medicine. I'm still taking the same blood pressure medicine, just in a quarter of it now.
And once
probably
every
every 5, 7, 10 days.
With your frequency now, how often do you get up and go at night? What is the lowest number of times to the maximum number of times you get up and go at night now?
Well, normally once or twice, but it also depends if I drink. Certain teas make me have to get up to pee more in the middle of the night. But normally once or twice, and if I don't drink teas or sodas, I normally don't get up in the middle of the night.
Nothing. How often do you have to go in the daytime? From 6:30 in the morning when you're up till about 9 or 10 when you go to bed. How many times do you think you've gone to pee in the past few months?
4 or 5 times max.
4 or 5 times a day?
Yes.
And that's not including the nighttime? So maybe 4 or 5 in the day and 1 at night or 2 at night? Is that what
No, I would say 1 at night now and then 3 or 4 during the day.
3 and 4 during the day and only 1 to maybe 2 at night, or
Right.
maybe none at night.
Sometimes none at night. I mean,
So you've gone from 18 to 20 times in the whole 24-hour period to now maybe 4 or 5 times in the whole
yes.
24-hour period.
Yes,
How
true.
amazing is that?
you sure sleep a lot better.
Yeah, you sure do.
You still get a lot more rest.
Did your doctors ever tell you why you were going to the bathroom so frequently and why the urge was so incredible before?
They told me it was just a blood pressure medicine.
And
That
so-
it makes you pee a lot more.
So for people who have a high blood pressure or taking blood pressure medicine, understand you can bring down the blood pressure because you got to find why you have what are the triggers that make the blood pressure go up. That's number one. It's not just an old age situation. Number one. Number two, understand that with him, the medication that caused the high blood pressure triggered the overactive bladder. When we got rid of the causes of the high blood pressure, we also got rid of the causes of the overactive bladder, and he's now have a normal bladder function. You also told me that you had pain that was going down in the back of the legs, the hamstring area,
Yes.
and the left side only.
Left leg only through the
Do
back.
you still get that in the left leg?
No.
That's gone. What about, you also had neuropathy, numbness and soreness in the soles of your feet. And so within the first about 2 months, I think, of this first protocol, up until recently, but you had, how much of a decrease did you have before the one incident? How much of a decrease in that neuropathy in your feet did you experience?
I would say 80 or 90%.
80, 90% better.
I mean, basically, it was just the very edge of my toes that were hurting. And then I went back and had that CT scan with that dye put in it. And it's like it re-triggered the top of it.
How much more of the numbness and the soreness has come back in the feet after they put the dye for the CT scan?
I feel like 40 or 50%.
Okay. So what happened was he had some infections that I found that were in his mouth that we had to clean out. In order to get the right diagnosis, I needed a CT scan of his jaw. The facility that did the CT scan made it mandatory to put a dye into his body, and immediately after he came out of the CT machine with that dye injection, he felt the neuropathy starting to trigger to come back worse in his feet. Up until that, now it's going to get better because we found that dye, we're going to get it out of you.
Right.
But up until that moment, he was about 80 to 90% better with the neuropathy in those feet.
Exactly.
Right? And we're going to get that back again. You also had one final point that I'd like to ask you that you can tell people, is you had a serious respiratory chest infection problem and sinus congestion problem. So two things, sinus and chest.
Yes, I was getting upper respiratory infections 2 or 3 times a year, every year for the last 7 or 8 years.
How many have you had since you met me and started with this first protocol?
Zero.
Zero. And that's been how many months now? Because you would expect to have at least one now between December and July.
I've not had none.
None.
None. Zero.
Because we found in his lungs he had mold and he had fungus in his lungs that we cleaned out. So now he's better with the lungs. You had chronic sinus congestion, right? Your
Right.
nose was always congested.
Stopped up, yes.
And the doctors told you that it's just a sinus congestion problem?
Right.
Okay.
Hay fever.
Hay fever, something like some allergy trigger
Right,
type of thing.
allergies.
And now the congestion doesn't feel like it's there.
No, it's much better.
How much better
I
would
mean,
you
my
say?
sinuses are probably, I'm going to say 80 or 90% better.
You watch how better after this round.
No,
That's for sure.
I have no doubt.
Yeah.
I mean,
Are there-
I just drove 23 hours from Texas to get here.
Yeah. And you brought...
And I brought my brother with
And
me.
you brought your brother with you because you knew how much better you got. You brought him.
You're right.
After his strokes in his brain, Is there anything else you want to tell people who have? Thank you for sharing this so far.
No problem.
I appreciate this to help people know.
I appreciate me being able to find a doctor that can fix something instead of, because my wife would always tell me, well, you want to go to the doctor? I said, babe, I've been to the doctor, and they can't find nothing wrong with me. I mean, like even after this last time I got kidney stones, did get kidney stones, and I was peeing blood from kidney stones. I went to the doctor. When I peed in the cup, they still said that they couldn't find nothing wrong with me. And I said, babe, that's exactly what the doctors always tell me every time I go. There's nothing wrong with me. My blood checks, my sugars, everything check out perfect. I said, yeah. And then I go and find you on the internet, and come the first round, amazing how much of a difference, how much life it gives you back. Your happiness, being able to smile, be able to be around people where you're not anxiety, don't have the anxiety, and just be able to have fun in life again. It's amazing to be almost completely off of blood pressure medicine. And I was only on it for 2.5 years. But I can tell you it changed my life. Well, I can start with saying that I'd been to several different doctors. I had the Obamacare, and my deductible was $10,000 on top of the hospital bills. I'm much better now. I'm barely taking any medicines. I think it's all because of your protocols. They've worked very, very well for me. I would say that it's been worth a drive from Texas back to here for 23 hours. I come back for my second round because I know it works. I feel probably 80–90% better. My wife says I have better moods, that I sleep better, I don't snore as much at night. I notice there's not the red lazy looks in my eyes, they're starting to turn white again. So I've noticed a lot of difference in my body. And I would say that you, sir, have changed my life tremendously. And I'm looking forward to seeing what this next round will do, and see if we can't get me back to 100% where, I can still go out on my 5 acres of land and mow and build buildings and finish all the stuff that I've started a lot of stuff that I haven't got to finish. I've got a big metal building that I started about 2 years ago, and I didn't have the energy to do it. So I'm looking forward to be able to do things again, because I've always been very, very active. And over the 2.5 years of the blood pressure medicines, it really changed my life, taking me south. And I believe that you're bringing me back up to where I used to be.
Awesome.
And I feel tons better. I'd recommend you to anybody. Like I said, I did bring my brother here that's had, I think he's had 2 major strokes, 5 minors, to see if we can't change him.
Yeah, we're gonna.
And I honestly believe that you're the man that can do it.
Thank you.
Like I said, I've been to several different doctors that they could never find nothing wrong with me. And said, hey, I even had my wife tell me it was in my head. And I said, all right, whatever. But she's seen a difference in me. Not like I have, because it's my body and I feel it. And when there's something wrong with you, it's wrong. Something's wrong with your body. And so I would definitely say, hey, it's a life changer to come here and have you do your testing, send me home, and within 90 days start feeling amazing.
Yeah, awesome. Thank you for sharing.
Thank you, sir. I appreciate you. I feel like you saved my life.
Thank you, man.
Thank you, sir.
You can get better. Real proof. Dramatic change from his bladder to his pain, to the pain in the head, to the respiratory, the sinus, blood pressure, and heart rate changes that are, it's second to none. When you find the infections and the chemicals that are in the body's tissues and get rid of them in a safe and very highly effective manner that's so rapid, it's life-changing. And I look forward to helping you too. We'll put the website name, domain here at the bottom of this video. I'll put up some other findings about him, and I really invite you to get yourself better, and you've got a great opportunity. Thank you again.
Give him a chance. You'll love it. Thank yourself for it.